So welcome everyone. Those of you who don't know me, I'm the chiropractor, Yoon. I'm also a martial artist too. Before I became a chiropractor, I've been a martial artist since I was 3 years old. And I still train 3 times a week, Monday, Wednesday, Friday. And the whole purpose of training is to keep my body nice and limber, so that way we age well. We're going to be learning some partner stretches. I don't expect everyone to be a gymnast after this, okay? So don't expect that, and then there are certain limitations that you can't do. I'm not going to push. Most of you are getting some treatments from me, and most of you are responding, knock on wood, relatively well. The problem is a lot of times when you go home, you go into bad habits. You sit a lot, you don't stretch, you don't move, and that doesn't really compound the things that we're trying to do for you. This is the reason why you're here, so you can learn certain things that you can do at home. Our body is composed of structures: skeletal system, muscular system, nervous system, and also connective tissue like ligaments and cartilage. These things have to work together. People say, well, I'm not flexible because my muscle is stiff. That might be true. Or, I'm not flexible because I'm getting older. Or I'm not flexible because I'm born stiff. And there's a lot of variation of flexibility. Some people are naturally flexible, some people are naturally stiffer. But I do believe that tightness of the muscle could be related to restriction to the joint. And restriction to the joint could lead to tendon wear and tear. And tension to the muscle could be related to nervous dysfunction. So having these kind of good balance between these 4 realms allows proper degree of movement and resilience. Now, in our daily life activity, we do too much sitting. Sitting down 8 hours a day is a very common thing in our society. When I was growing up, computer was just beginning. And before computer, people tend to go outside, play, go on the monkey bars, play around. These are a very common thing. But nowadays, I notice that even kids are sitting too long. They're on their phone, computers, video games. And while you're sitting, what happens to your body is your body starts to shorten. When you're sitting like this, all these muscles start to shorten, certain parts of the body becomes weak, and your whole body starts to kind of curve forward like this. So if you're doing this 8 hours a day for about 5 years to 10 years to 15 years, all of a sudden you try to get up, this kind of posture becomes a big challenge. Okay? So that's a huge problem. Second thing is, because we're not moving well, we start to gain extra weight. We start to lower our metabolism, areas that you don't want mass. You start to lose muscle mass. And so your metabolism starts to reduce, you gain weight, putting a lot of pressure to the spine. On top of that, we tend to fall. Okay, who hasn't fallen in their life? Most people have fallen. And when you fall, you don't typically land in a soft, cushioned surface. People typically land on a hard surface, and it can cause twisting of the joint, they can land on your back, they can have concussion, and these traumas, even though it may be a very slight thing, could cause compounding effect. Now, how many of you ever noticed when you fell as a kid, it was not a big deal, right? But when we fall now, it becomes a little bit harder to recuperate. How many of you ever kind of noticed that? That's because our body ages. And as we age, we start to lose flexibility. And what we don't use, we start to lose. So when we're always sitting down like this, and all of a sudden you get up, and your muscles are tight already, and you slip on ice, and you land on your back, what happens to your joint? It becomes jarred even more. Okay? The key thing is, protect it while you still have it. Don't wait until you have a big problem and fix it. Protect it while you still have it. When they sit a lot, they start to lose abdominal strength. Okay, and you start to have weakness to the rectus abdominis, and also weakness to the gluteus medius maximus. So this muscle becomes weak, this becomes weak. Then all of a sudden you start to have really tight quadricep and really tight lower back muscles. Okay? So when you have weakness, these muscles have to tighten up to try and compensate, which causes a lot of stress to your body and your spine. Japan has a lot of earthquake, right? And each time you have earthquake, if the building doesn't have flexibility and resilience, it's going to fall apart. Our body has to be the same. this is strong enough, but it also has the flexibility. This is the concept that we want to be able to be. We want to have stiffness, but also have the flexibility to move. Now, a lot of times, our body, as we age, does not become like that. It becomes more like a hard stick. Okay? It's super hard, but I can take a hammer and do this, it will break. But if I take a hammer and hit that, it won't break at all. So how do we make sure that our body becomes like that? Is because we need to have the balance between the spine and the structure. Now, these are the muscles, as I mentioned: shoulders, lower back, calves, quadriceps. These are muscles that are really, really tight. We're gonna actually work on that. These green areas are the areas that you have weakness. We're not gonna be doing any core exercise today. Okay, we're gonna focus on flexibility, okay? So first of all, we're gonna work on neck range of motion first. Now before we do that, I recommend people warming up. Okay, because when you warm up and you have a little bit of body temperature increasing, your muscle starts to become a little bit more limber. Okay, so the best thing to do is when we warm up, of course, running, jogging, those things does help, but some people cannot run because of the knee or the hip. So that's where the partner is going to help out. Okay, so Victor, come over here, please. I'm going to demonstrate. So Victor's going to first sit down on this chair. And what I want everyone to do with a partner is you put your hand and then you just kind of gently rub around the shoulder. So it creates some heat and friction. So I'm going to all around the spine like this. Making you guys work out, eh? So the best thing to do is stand to the side. Tap the knee. You don't have to go all the way high, but you can do a little bit lower too. Okay? Get off the mat so you don't fall off. And if you want to do a little bit higher, that's good. Good. Do nice and slow. For you just here. Let's get that heart moving a little bit. Warm it up. There you go. Arms. Hip. Push it up. Okay? Almost like a little flat. That's it. Good. Okay? Lift it. Grab your arm. Okay. And stop. Grab your waist. Tuck your chin. Center, look up. Center, down. Center, turn to your right. Center, left. Center, right. Center, left. Left ear, left shoulder, look up. Right ear, right shoulder, look down. Opposite way, full circle. Left. Arm, I'm just gonna rotate outside. Good. Outside, inside. Now. Good. Now inside. Now look at 1, 2, or up, in, up, in. Shallow, deep. Good. Shallow, deep. Good. 1, 2. 1. Good job. 2. Made me do this with my arm, this with the arm, here and here. These are all rotator cuff, bicep, tricep stretch. Fingers together. Out. In. Now if you can't go far, if you go over here, that's okay. Just here. And then out. Here. And then out. Now straight up. And out. Straight up. Good job. Arms across and pull the elbow in. So when you do this, you're stretching the posterior down. Good. Right side. Good. Now arms up, over, O, stretch. And if you can't go all the way, that's okay. You just kind of hold it in place. Opposite, stretch. I'm gonna do this. You see how my elbow goes in? I'm bending my wrist. That's it. And back. Good. Now, finger interlaced. Okay, some people may have hard time, so don't force it. Turn, 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 and stretch. And back. Okay? So if you can't go all the way, that's okay. If you're here, it's okay. This is challenging all the ligaments of your wrist. Okay? And back. Then the other side. And then turn. Oh, it feels so good to me. The hamstring and the chest. So I want people to kind of hold, I like to hold the finger like this. Okay? Okay? Those of you who don't, hold it like this. Okay? Now from here, what we're going to do is open double shoulder width apart. And just slowly lean forward and stretch. Hold down, you exhale. And back up, breathe in. Is use a chair. Good. You guys are good. You need to take a break. Okay. His leg is straight, and I'm just gonna stand right behind him and right around his mid-back area. I'm gonna assist him. And slowly stretching. And back up. And then assist, slowly stretching. Now this is going to be a little bit tight for people, so take it easy. Slowly leaning forward. And back. Now, if you have a hard time bending this leg, one leg straight. So I'm going to open my leg V. Okay? And hold it at this position. Knees locked. Okay? Hold, and he's going to help me lean forward and just stretch. Okay? And then to the right, stretch, to the left, stretch. So, a lot of people don't stretch the adductors. They do a lot. It hurts, but it feels good.
Yeah.
I just simply roll, roll. Now don't touch your head. Okay? Keep it, keep your chin tucked, and just roll back and forth. Yeah, you gotta sleep really well tonight. So how often should you be doing these stretches? I don't recommend you doing this every day. But simple neck exercise, shoulder exercise, arm exercise, you can do it every day. Okay? Leg stretches 3 times a week. Do it Monday, Wednesday, Friday. Okay? If you start that out in the beginning, your body will get so much pain. You know why you're in so much pain? Because your body is not used to moving. Now the patients that are coming to see me, like yourself, you could probably better handle this movement compared to someone who hasn't got the treatment. Why is that? Why do you think that is? Any guess? Why would someone who's getting the treatment respond relatively okay versus who's never got the treatment? Because you know the treatment that we do is already a passive exercise that I'm actually doing on you. Now, if I just kind of did the acupuncture and let it go, it affects the muscle only. If I did the Graston and acupuncture, we do muscle and connective tissue. If I do an adjustment and Graston and acupuncture, we affect the spine, the joint, muscle, and tendon. So your body's been being moved. Now all you're doing is making you do a bit more homework to emphasize what we've been doing for you. Does that make sense? Today, you learn some stretching. 2 weeks ago, we did self-massage. I actually did teach acupressure. That's coming up on November the 13th, Saturday. Okay? We're teaching people how to do partner acupressure massage. Who's interested in that? But if just doing self-massage and stretching alone, when you have some problems to your spine, it doesn't help. A person may actually have a car accident that led to some neck injury, that led to some numbness, that led to arthritis. Stretching alone will not help. As a matter of fact, maybe the stretching could hurt it more. So my suggestion is do this, but also realize what problem you may have. So in our clinic, we focus on structure of the body, the skeletal system and muscle. Then we teach them how to do stretching and conditioning, then improve your performance. So it's like golf. People say, I want to be a great golfer, so they buy a $1,000 club without working on their body. They have inflexibility, they have problems, and they bought a $1,000 club thinking that they can play like a pro PGA player. It doesn't work that way. Work on yourself first. Work on your mobility. Then condition your body and your flexibility. Then go for the equipment. Okay? So our clinic, we offer a lot of different techniques. I have 4 tools that we can work with. Because the body cannot be treated to a 15-year-old versus someone who is 80-year-old. It cannot be the same. Everyone's unique, everyone's different. So you must have the tools to actually assist that. So hopefully today you guys had some good information. Who learned today some good information? Well, thank you for coming today. Hopefully you guys enjoyed it. And like I said, guests that are here, please stick around and talk to me, see whether or not it's beneficial. Thank you very much.